Kaylee Cuoco and Sam Claflin star in the MGM Plus original series, Vanished. When the man Alice loves disappears on a train to the south of France, every romantic memory becomes evidence. Every intimate detail, a potential threat. She thought she knew everything about him, but she may not even know his real name. 4-part thriller Vanished premieres February 1st on MGM Plus. Finding the truth is a dangerous affair.
Hi everyone, I'm Deb Flashenberg. Welcome to Yoga, Birth, Babies, a podcast produced by Prenatal Yoga Center. We will be diving into everything prenatal yoga, birth, and baby related, hoping to inspire, educate, and empower you through your journey into motherhood. Thank you for listening.
Hi, I'm Deb Flashenberg, and I'm your host of Yoga Birth Babies. And today we're going to talk about postpartum depression, what we know, what we miss, what's changing. So to have this conversation, I have Dr. Karen Sheffield-Abdullah. Let me tell you a little bit about her. She is an assistant professor, a certified nurse-midwife, a mindfulness coach, and a researcher whose work centers on perinatal mental health and birth equity. Her expertise has been featured in outlets such as the New York Times, Politico, TED Talks, and NPR. And Karen is the co-investigator for Mom Genes, a research study advancing precision approach to postpartum depression. I loved this conversation with Dr. Karen. She had such compassion and such insight. We really dive deeply into understanding how the understanding of postpartum depression has changed. What it was thought about 10, 20 years ago is different than how we even use the term postpartum depression. Now we often just say PMADS because that encompasses anxiety and OCD and rage and trauma. And in this conversation, we talk a lot about what is taking place during that experience, what's happening to the nervous system, the role of hormones and sleep disruption. We also, because Dr. Karen has a wonderful TED Talk, we also do dive into bias and racism and what's happening when someone feels dismissed from the healthcare setting and why they're not receiving the type of care they should be. It's a really wonderful talk, and it's so chock full of advice, as well as advice for those around them and how to support them. So I think you're going to get a lot from this conversation, whether you are pregnant and you're heading into that postpartum time, or you're already in it, or you're someone that supports people during postpartum, or you're a family member and your loved one is having a baby soon and going through this huge transition. I think this is going to really speak to you. Now, before we get to my talk with Dr. Karen, I always love to give updates about what's happening at Prenatal Yoga Center. So really the best way is to check out everything on our website. So go to the website, dig around. It's prenatalyogacenter.com. We've got our online, our in-person, our on-demand schedule there. We have all of our workshops, our childbirth ed workshops, our teacher training workshops. So much is there, as well as past podcasts. So you can take a listen to those. And we have a blog that I've been doing for like 18 years. So there's so much information in there. I also want to thank you for two reasons. One, people have been leaving amazing reviews. So thank you for that. If you haven't done that yet, please take a moment and do it. And the other is I've been asking people if you have a topic or you think you are someone that would be a great guest to reach out. And people have. And thank you, because that's the way I get new guests on here that I might have not been aware of. So you can check everything out on our website. You can go to the website, prenatalyogacenter.com. You can fill out an application if you think you'd be a great person for the podcast. And if you just have a topic, let me know about it. Deb at prenatalyogacenter.com. All right, that is enough of me. You can tell I'm a little stuffy, so I think I'll stop talking now. And we're going to take a brief moment, and when we come back, you'll enjoy my conversation with Dr. Karen.
Every sip of Coca-Cola brings you closer to the excitement of the FIFA World Cup 26. Because nothing compares to the joy. So grab a Coke and drink in the FIFA World Cup 26. No purchase necessary. 13 plus in 50 U.S. states and D.C. with a web-enabled device. Ends March 1st with 8 entry periods. Rules at cokeurl.com/soccer rules.
Hi, Dr. Karen. How are you?
I'm well. Happy to be here.
Oh, thank you. I'm really excited to chat with you. I feel like postpartum depression is one of those things that people talk about, but maybe they don't really know. And I love that we're going to get into some information about how it's changed. So thank you for sharing. And,
Absolutely.
and so before we jump into kind of some of the nitty gritty, why don't you tell me a little bit about yourself and what led to your passion to study and advocate for perinatal mental health?
Yeah, so I am Karen Sheffield-Abdullah. I'm a mother of four, ages 28, 25, 23, and 14. I am a nurse midwife, been a nurse midwife for 20 years. I'm also a mindfulness instructor, trained in mindfulness-based stress reduction, and really super passionate about all things mental health, women's health, and integrative health, like mindfulness, yoga, massage, things of that nature. So, um, in full transparency, I'm someone who has coped with the symptoms of anxiety and stress across my life, and have recognized that as I've seen patients across the lifespan, we don't really do a great job of holding space for them to address their mental health. We really get focused on physical health, but not mental health. And in particular, thinking about perinatal mental health, how are we supporting those who are coping with the symptoms of maybe anxiety or depression or OCD or PTSD or complex PTSD, and how do they navigate that during pregnancy and the postpartum period? And also, how do they navigate it with taking medication or in therapy or a combination of both? Oftentimes, pregnant individuals feel really hesitant to take medication during their pregnancy to address their mental health issues. So, wanting to normalize the conversation and really to help us as healthcare providers best support pregnant and postpartum people through their journeys of their mental health, because you really can't have health without mental health.
Oh, that's so true. And I love that as a nurse midwife and yoga, how you take kind of that holistic approach. That's really beautiful. So when we talk about postpartum depression today, what do you think we understand that's different now that maybe we didn't, 10 or 20 years ago? How has it changed our understanding?
Yeah, I think, back in the day, we used to talk about baby blues, right? And we used to just think that individuals were having kind of an exaggerated emotional response to childbirth, or maybe some type of hormonal crash that they'll just bounce back from. But what we understand now is that postpartum depression is multifaceted, it's multifactorial. There are things that we need to be thinking about in terms of not just hormone levels and what happens to hormone levels, but hormonal sensitivity, meaning how do our individual bodies respond to those changes in hormone levels after we give birth. Thinking about the changes in inflammation and stress response that happens during pregnancy and postpartum. Thinking about the role of sleep deprivation, right? And how there are changes or disruption to our normal circadian rhythms or just our normal wake and sleep cycles. And then thinking about our psychological history and social stressors. So we've really shifted from postpartum depression being more of a mood issue to being more of a brain and body connection. And how do we manage that? And in the past, we used to think about it just occurring during the first 4 to 6 weeks postpartum, right? And we would talk about it during the postpartum visit. But what we know is that depression can occur during pregnancy, and it can also occur months after delivery, even up to a year postpartum. And thinking about the way that if an individual has a history of postpartum depression or a history of anxiety or depression, that can increase their risk of developing postpartum depression again. So really wanting to think about the different ways that we think about postpartum depression, and that postpartum depression can also have an anxiety component to it, and also can be related to intrusive thoughts, rage or irritability, can overlap with with PTSD, and can sometimes mask bipolar disorder. So I'll stop there because I can continue to go on and on. But just wanting to think about those changes, as you said, over the last 10 to 20 years, even the way we used to treat it has changed.
Well, even the names change because right now, PMADS now covers that whole spectrum, like you just explained, like rage and PTSD and anxiety, because for a while we just thought it was postpartum depression, but perinatal mood and anxiety disorders. So I think that's a huge step. But I also want to go deeper. You were mentioning the hormones. Can you talk a little bit about that hormone change? Like once the placenta comes out, like the hormones drop. It's such a dramatic drop. So what role do the hormones, and you mentioned sleep, and let's throw in the nervous system because that can be a little awry. How do those factors play into postpartum depression?
Right. So kind of getting back to, yes, there is a big drop in estrogen and progesterone and also another hormone called allopregnanolone or neurosteroid. But really thinking about it's not just the drop, but it's about our sensitivity to that drop. It is so individual for every person, right? So thinking about how these shifts in hormones affect our nervous system, affect the way we regulate our nervous system, and it can really lead to stress reactivity, lead to sleep disruption, and also lead to disruption in the way that we're able to regulate our emotions. And so thinking about this idea that before we just thought that, women would develop postpartum depression. But what's interesting is when there's a hormonal drop, not everybody develops postpartum depression, right? Some do and some don't. And that's what we come back to this sensitivity and how we are made up, how our bodies are made up, and how we're all individual, and the way that our brains respond to that drop in estrogen and progesterone really shifts. And you're right, as soon as that placenta comes out, there is a huge shift, and the way that shift impacts our body is very individual. And so we don't want to just look at levels per se. We want to really think about the person individually and how the lower amount of hormone impacts the brain and how the brain decides to respond to that.
Okay, so this might be kind of off the cuff. I'm kind of just spinning. So I think about the menstrual cycle and how there's fluctuations there. Do you think there is some idea of if you have a lot of sensitivity during one's menstrual cycle with the fluctuation of hormones, how that might give you an indication that the hormone levels, that you're very sensitive to the hormonal shift that might happen at the end of pregnancy, that does happen at the end of pregnancy?
Yeah, I think you're right, Deb. So the individuals who have like premenstrual dysphoric disorder, right, or maybe some sensitivity surrounding significant PMS during their menstrual cycles are definitely more sensitive to developing a postpartum depression or depression during pregnancy just due to the changes in hormones. So you're exactly right there.
Oh, wow. Yay for me. Okay. I thought that was like maybe I'm
look at you. Look at you go. Yeah.
All right. So let's talk a little bit about stress, because I feel like what new parent doesn't have some stress, and then prior trauma influences on postpartum mental health, like especially in those early weeks after birth.
Yeah, so when we think about stress, oftentimes we think about cortisol, right? And what happens with cortisol levels. And after we deliver, stress hormones like cortisol can become flattened or dysregulated. The brain is thinking about how to get safe. It's prioritizing survival over connection or joy when we're thinking about the stress response immediately after giving birth. The nervous system doesn't power down after birth, if you will. So really thinking about how stress levels can impact our ability to cope. right? And then when we couple that with sleep loss, that intensifies how reactive we can become with our nervous system, right? And how dysregulated our nervous system can be, and our mood can be worse. And that hormonal sensitivity also worsens when we're vulnerable to sleep deprivation. So there's all of this kind of feedback loop that occurs when we're thinking about sleep and nervous system and stress. Absolutely. And that's why it can escalate postpartum depression pretty quickly.
And what about if someone does have prior trauma influences? How can they best prepare? Or I guess it's also, again, I'm just kind of spinning a little, they might not even know they might be having trauma emerge, something past. How can they help prepare themselves?
Well, with a history of trauma, hopefully that's something we're picking up on during the prenatal course. So as a healthcare provider, when I'm doing that initial intake and I'm asking questions, hopefully I'm getting at any history of trauma, and then providing care that is trauma responsive. It's not enough that we're trauma informed, but really being able to be responsive to what our patients or our clients are experiencing regarding trauma, and being able to have an appropriate response towards that. And if that involves getting them into therapy or assisting them with getting access to therapy or modalities that might be helpful for them to manage or cope with the trauma that they've experienced previously, is super important. And also checking in regularly throughout the pregnancy, because there are going to be different periods of time where that trauma might show up. So if we want to even just give an example, say, of a person who has a history of miscarriage that was traumatic for them, we're going to want to think about the time period when that miscarriage occurred, and really making sure that we're checking in to see how that person is doing around that time. And then also checking in every trimester, and certainly checking in the third trimester, the closer they get to delivery, that trauma and that anxiety might be ratcheting up at that time as well. And then, we can't say enough about birth trauma, and what happens when an individual has less than an optimal experience during labor and delivery and birth and postpartum. And that could show up in multiple ways. That could be ending up with an emergency C-section, or just a C-section in general, right? That's major abdominal surgery. That's trauma to the body. That might be contrary to the way you thought your birth was going to be.
Or just belittled or not heard. Sorry to jump in, but that's one of my passions.
You're right.
It's such one of my passions that people can feel traumatized, where to the outside eye, they're like, but you're fine, baby's fine. But they were just really dismissed. So sorry, I didn't mean to jump in, but it was like bubbling. I had to say something.
Yeah, no, I think that's a really good point. And that is something that I have found in my work and in my research when talking to birthing people, mostly those who are the most minoritized, marginalized, overlooked, and underserved amongst us. They talk about not being heard. They talk about not being listened to. They talk about verbalizing what their concerns or issues are and them being dismissed. And we only need to look at the news, right, and see how people have been dismissed. Their concerns have been dismissed. They've been sent home only to deliver at home or deliver in the car. And so that is a very real trauma that people are experiencing and navigating, and having individuals that perhaps look like them or don't look like them, and what that experience is like in the labor and birth time period. So thank you for elevating that, because it can't be overstated how important it is that when an individual, a pregnant individual, tells you something isn't right, believe them.
Yeah.
They are the experts in their body. They know what is going on for them, and we need to listen to them.
Oh, 100%. So if to the outside eye, the person looks fine, they are functioning, but they have had trauma or anxiety or rage. Because as we said, most of the time people think, oh, just depression. But as you pointed out, PMADS covers, anxiety, OCD, rage, trauma. How did these show up differently? And how can the family around see that? And I guess, why are they often missed? That's kind of a big question.
I think they're often missed because we're, as healthcare providers, are too busy with the number of patients that we're seeing in a given day, and just don't actually have the time to sit down and actually have a conversation. I also don't think we're adequately screening individuals with the different screeners that are out there, whether they're for depression or OCD or for anxiety, and recognizing that screeners aren't meant to be a one and done, but they're really meant to be just an opportunity for you to be able to have a further conversation surrounding whatever it is you were screening for. So if you were screening for anxiety, you go into the room and you have a conversation about, I see that you answered this question in this way, or can we talk a little bit more about what came up regarding your anxiety or depression or OCD or whatever it may be, and how can I as a healthcare provider best take care of you in this setting with this trauma that may be present. And really listening, because I do believe that the community has the answers. I believe that the woman has the answers, or the birthing person has the answers as to how to best take care of them. We don't always have to figure it out, but the way that it can show up differently in people is very individualized, right? So some people will just be stoic. Some people will emotionally suppress. Some people will just truck on, determined to succeed despite limited resources. For some people, it might show up as hypervigilance, really being worried about things and asking lots of questions. For some people, it can show up as not showing up for appointments, or avoidance. But when somebody doesn't show up for an appointment, I want to make sure that we're clear that we want to get to the reason why that person hasn't shown up for an appointment, thinking about what we call social drivers of health. Is it a transportation issue? Is it an access issue? Is it, a life issue? Life is life, and they have multiple demands on their time. They are in a caregiver role with a family member. So there's lots of ways that mental health concerns can show up during pregnancy and during the postpartum period.
So I want to kind of go back to that screening idea, because as it stands now, and you know this better than I do, most people just have a 6-week checkup, which is usually pretty quick. Sometimes, especially I find more in the midwifery model of care, the midwife might check in more often. I know I had, I'm very honest about my births. I had 2 home births. So my midwife was very present. She came back to the house several times. I had to check in with her daily for several weeks, but that is not the standard. So if you could wave, I'm throwing this at you, if you could wave your magic wand, what would screening and postpartum support look like? Because again, if we're at that 6-week where I don't think even everyone shows up for that, and sometimes it's just on telehealth, what would that look like so that people don't fall through the cracks?
So we know that the American College of Obstetricians and Gynecologists recommends that we screen at least once during the pregnancy. But depending on the type of practice you're at, oftentimes they'll screen every trimester, which is what I would at least recommend at the very least, is that at the initial visit screening, then in the second trimester, third trimester, and then postpartum. But I wouldn't say that we should be waiting until the 6-week postpartum visit, because that visit is notoriously underattended.
Yes.
So I would say that if you can, at the 2-week visit, make a 2-week visit of a check-in of how are you doing, how are things going, how are you coping, and then again at a 6-week visit. And then typically after the 6-week visit, they're off to going back to their primary care. And there's no reason why primary care can't also screen, but I will say that more times than not, postpartum women are not being screened by their primary care physicians regarding their mental health. And if they are perhaps not as in depth as it needs to be, as you mentioned. The postpartum visit can be rather quick. You are right. As a midwife, I'm biased. Our care tends to be more holistic. We're looking at the person, not just the pregnancy, but how they're doing, how the baby's doing, how family is doing, and also multiple visits. So if I had, a magic wand to wave, I would say that we, first of all, need to normalize the conversation surrounding mental health. And I would say that we could even think about everybody opts in to mental health screening unless you opt out. So everybody automatically gets screened at 2 weeks unless they opt out from a screening at 2 weeks. Everybody gets screened at every trimester unless they opt out. That way, we're not making assumptions about who we think needs to be screened and who doesn't.
Just making it kind of, this is standard.
A standard.
I
That's
love that.
exactly
I
right.
love that.
Standard of care.
I love that. I remember speaking to a pediatrician on the podcast, and she said something like, "Oh my gosh, my pediatrician actually did that." I realized several years later, my son is 14 and my daughter's 11. So like this just occurred to me maybe last year. I'm like, oh wow, my pediatrician was screening me. So she had me stay longer. She's like, why don't you just stay here and I'll just watch you, I'll just watch you feed. And she sat and chatted with me. And I realized, I'm like, I bet she was checking in on me. She was one of the best people. She was just so caring. And I'm wondering if that is standard that pediatricians are also checking in on the new parent. What are your
Yes. Pediatricians are often checking in because they actually get seen. The pediatricians see the postpartum individual
lot?
a lot and sooner than we see them at a 6-week postpartum visit, unless we're doing an earlier visit. But even still, the baby's getting evaluated multiple times within that 6-week time period. And it's a beautiful time for the pediatricians to be able to also screen. And so I know that screening does occur in many pediatric offices. That's not uncommon to hear somebody say, oh, my pediatrician administered a screener for me.
Yeah, and I don't think I even realized what she was doing because it wasn't anything formal. It was just more like a stay and chat. Let's just hang out. Let me see how you're doing. And I think that was wonderful. All right, we're going to take a quick break, and when we come back, we're going to jump into kind of a big topic about bias and racism. Not taking that lightly. So we're going to take a break. We'll be right back. Okay, we are back. So I watched your TED Talk, first of all. It was really, really good. I'm actually going to have that part of our teacher training. Now we do a prenatal teacher training, and I thought it was really important. So I'm including that in our curriculum. So thank you for doing that, and which leads me to my question. How do you think bias, racism, and dismissal in healthcare settings affects who gets diagnosed and who receives care?
Okay, well,
There's a can of worms we just opened. Here we go.
yeah. So certainly we know bias, discrimination, and racism are key contributors to adverse pregnancy outcomes. That has been borne out in the literature for decades, that we know that stress is a key contributor to preterm birth. We know that anxiety is a contributor to preterm birth. We know that Black women have twice the rate of preterm birth and low birth weight compared to the global minority. And really thinking about the fact that stress, racism, discrimination, bias, we only need to look at the last 5 years, 5 months, 5 weeks, 5 days. It's been stressful. It's been traumatic, especially for Black and brown people in this country. And so when we think about it within the maternal infant health space, it looks like making assumptions about even things like the thickness of the skin of a melanated person. When they've done studies and asked medical providers whether or not Black individuals have thicker skin, they say yes, right? And we know that is not true. There is nothing inherent within melanated skin that makes it thicker than somebody else's. We also know that when we think about stress and racism, there's a lot of hesitance and mistrust and distrust of the healthcare system by Black and brown individuals that don't want to even share their experiences with their healthcare provider, or they're scared to share their experience with their healthcare provider for fear that Child Protective Services will be involved or be at the birth when they deliver if they have a vulnerable moment and share that they were anxious or that they were stressed about something. And we also know that the higher we go in socioeconomic status and educational attainment, the worse the outcomes are for Black women. So that is not protective. And so, in fact, we know that a PhD prepared Black woman will have worse outcomes, pregnancy outcomes, than an eighth grade educated white woman. And so why is that? Why does that persist? And I would argue that it has to do with the experiences of racism, of discrimination, of bias, of not being listened to, of not being believed, of not being heard, of not being valued. That absolutely contributes to the fact that we're 3 to 4 times more likely to die due to a pregnancy-related concern. So there's so much there that needs to be addressed that isn't addressed. And we also know that, ideally, from studies that I have done, ideally, many Black individuals would love to have a racially congruent or culturally congruent provider take care of them, but that's just not the reality just due to the demographics of the healthcare profession. If you think about midwives, 6% of the midwifery profession identify as Black, less than 1% identify as Indigenous. And then if we also think about within the medical profession, I think it's similar, where only 6% of physicians are Black. And so it's just not as likely that we're going to have a provider that looks like us. And so if we don't have a provider that looks like us, can we at least have a provider that values us, that sees us, that hears us, right? And that takes the time to listen and takes the time to be culturally humble. I don't think that we can ever be culturally competent in another person's culture, but I can be humble enough to say, what do I need to know about you to best take care of you? And take the time to listen to that.
Thank you. I feel like I don't even know where to follow up with that, except thank you for being so open and honest about that.
Yeah.
If someone falls into feeling like they're not being heard and they're being racially profiled, I guess, for lack of a better word, what can they do? How can they advocate when they're for themselves and they feel like they're going up against a system that is not believing or supporting them?
Yeah, so that's a tricky one for me because I don't think the onus should be on the
Oh, it
patient or
should
the
not. It
client,
absolutely should
right?
not. But I want the, I'm feeling like how I guess the system has to change. We know that. I mean,
Right. So I challenge us as myself, right, as a healthcare provider. I challenge my profession and the medical profession with really thinking about what are the ways that we can do better. How can we listen? I know that I personally will go around the country and do grand rounds where I speak to my physician colleagues about the experiences of stress and racism in Black maternal populations and the importance of us listening to them. But as a patient, as a client, what I would say is if you're not being heard, find somebody else because you can absolutely find decent care with somebody who is not of your race. It may not be what you optimally want, but to keep talking to different providers until you find somebody that aligns with your core beliefs and values. People also talk about doulas, right? And the role of doulas as advocating for what their clients need during pregnancy, labor, and birth. And so the doulas can really act as somebody that is buffering, if you will, the conversation between provider and patient there. So that's another way, if you feel like you're not being heard, to have a doula that can help navigate that.
so will you talk about the mom gene study, what it is, why it's important, why we need to know about it?
Yeah, so I'm part of a team at UNC Chapel Hill that is doing a study that's funded by the NIH that is looking at postpartum depression and really interested in the genetic component of postpartum depression. So people who can be part of this study is anybody who's been pregnant. So you could even be a grandmother now, but you could still be part of the study. And the reason why we're really interested in this is that we know that there is a genetic component to postpartum depression. Like if my mom had postpartum depression, it's more likely that I will also have postpartum depression or depression. So really wanting to understand that a little bit more. And what we know historically from research studies is based primarily on postpartum depression in people of European ancestry. And we don't know as much from minoritized individuals like Black and Latina women. So we're really interested in all people being part of the study, but specifically wanting to reach out to those that identify as Black or Latina to be part of the study. And what's involved is that you would do a survey, and then you would also do a blood sample, and then you would receive reimbursement for that. And so the way that you can find out information about it is going to momgenestudy.org. And we'd be happy to talk with you and happy to have you join the study.
I think that is so cool. So first of all, we'll make sure we put that in the show notes, momgenestudy.org. But I'm getting a little geeky, but I love the data and the genetics behind this because one, I don't think I would have ever thought to ask my mom, I don't know why, about her postpartum experience. But that's such a great understanding of the genetic component. And also, as we talked about preparing, should you have that genetic disposition to have that risk to help support yourself as you approach postpartum. Maybe it's meeting with a therapist while pregnant, or maybe it's talking about medications. I know you talked about that in the beginning, but having that knowledge can really help arm you and bolster you as you go into this massive transition.
Yeah, and one of the things I want to elevate too, if I could, is that it's really important to remove the stigma associated with mental health and medication during pregnancy. And I think a lot of times healthcare providers are still counseling people off of their medications during pregnancy. And I want your listeners to understand that there are very few medications. There are very few psych medications that you are taking for your mental health that cannot be continued during pregnancy. We should not be counseling people off of their psych medications during pregnancy. We want healthy mom, healthy baby. And if mom is not well mentally, baby is not going to be well, and mom's physical health is not going to be well. So I really want to emphasize that there are some medications, but there's very few.
Thank you. I actually did a podcast about which medications one can breastfeed with. So I will make sure that we also link that, because that was a concern. I've heard that from students, like, can I breastfeed with this? So I thought if there's a question, then I needed to find out more. So I'll make sure we include that in the show notes. So thank you for pointing that out, which kind of leads me to what should partners and doulas and clinicians and all of us that support pregnant folks and postpartum folks, what should we be doing differently to support postpartum mental health?
One of the things that I think of is, don't assume that because somebody looks like they're okay, that they're actually okay. One of the things that I have found in my studies that a participant said was, I might be functional. That doesn't mean that I'm doing all right. Right? So you might be going through your daily activities and are completely functional, but on the inside, you're struggling. And so I think as communities, we really need to go back to checking on, as they say, check on the folks that that look like they're doing okay too. Not just focusing on those that seem like they might need the support, but focusing on all people. And I think that gets back to our point about providing mental health to everybody, and then they opt out of needing it. Really thinking about checking in with everybody, especially during these unprecedented times. Just the climate that we live in. I don't believe that our nervous systems were ever set up to be managing the type of chronic toxic stress that we experience over and over and over again, and thinking about the impact that has on the body. the weathering, the breaking down on the body that this type of stress can have on us. So really wanting those who are in the system, whether they're doulas or midwives or physicians or community health workers, lactation consultants, really just normalizing conversations of how are you really doing, like for real.
That's so
Like really,
important.
what's going on? And one of the things that my research participants have said is, if you really want to know what I'm stressed about, ask me what I'm Googling,
Oh, I love that. That is so
right?
smart.
So if you think about what is it, if we check anybody's Google history or search history, you're going to know what's on my mind. You're going to know what I've been thinking about. And you can only imagine that for those individuals that may be Googling things about their potential birth outcomes, especially Black and Brown people, that is very stressful to be reading. If you know that you're at increased risk for preterm birth or low birth weight or of dying, that is stressful. And so taking the time to say, you know what, even if it's kind of like as a little bit of a joke, but like, what are you Googling right now? Like, what are the things that are on your mind?
Oh,
That's when you're going to find out what's really going on.
something I've never heard that. That is brilliant. I think I'm going to use that even with my kids. Be like, hey, what's on your mind? What's your Google
Yes,
search? I love that.
that's exactly right. That's exactly right. And I love it too. And I love the fact that it came from the community, because the community has the answers. I couldn't have come up with that myself, but they told me, don't ask me if I'm sad. Don't ask me if I'm sleeping a lot. Ask me what I'm Googling.
Oh, I'm stealing that. I will give you all the credit, but I'm stealing
Okay.
that.
Very good. Yeah.
So, if somebody's listening to this podcast right now, maybe they were scrolling through and they saw the words postpartum depression in the title and they're like, okay, I'm relating to that. So, they're here, they're struggling. What would you want someone in that turmoil right now to hear?
I want them to hear that they're not alone, that there are people that are available for helping them. There are tons of different organizations, and I can give you those organizations, Deb,
Please.
to attach if you would like. But certainly places like Postpartum Support International or NAMI, National Alliance of Mental Illness. There's a Maternal Mental Health Leadership Alliance. There are lots of resources out there for you, but I want you to know that you're not alone and that postpartum depression doesn't look just one way. You can also have anxiety. You can also feel hypervigilant. You can also feel super tired. You could also feel not tired at all. You could be sleeping a lot. You could be sleeping not at all. So there are lots of different ways that postpartum depression can show up. Or postpartum anxiety or PTSD, right? So when we think about PMADs, wanting to make sure that we're inclusive of all the feels, all the emotions that can be arising for our postpartum people and letting them know we're normalizing this conversation. You cannot have health without mental health. Your mental health absolutely matters, and we want to hear from you.
That is wonderful. Okay, we're going to take a quick break. When we come back, now you've given so much amazing advice, but this is specific. So when we come back, what is one final tip or piece of advice you'd like to offer to new and expectant parents? All right, think about that. We'll be right back. Okay, we are back. So I know you've given such great advice already, but this is anything that kind of popped into your head. You are a mother of 4. You are a nurse midwife, so you've been in this a long time. So what is that one final tip or piece of advice you'd like to offer new and expectant parents?
You know, I think the thing that you just mentioned, parents, right? So a lot of times in the majority of this podcast, I've only spoken about the birthing person or individual, but we can't forget about the partners. So if there's one thing that I want us to remember is to also remember the partners. The partners are also navigating this as well, whether they're new parents, whether they're dealing with all the competing demands, all the stressors like finances or work or family, extended family. One of the things that I've heard from individuals that I've talked to is don't forget about partners. partners need support as well. And if we're supporting partners, the partners can support the mom or the mama, right? So wanting to really think about the community and having them think about the importance of having our community around us. And I think we used to have that back in the day. And I think we've moved away from that a bit. But if we look at other countries and other cultures that seem to be getting it right, they do spend more time as a community, as a family unit together. And that includes, if it's not stressful for you, in-laws or grandparents or cousins or aunties that can be there to support you during this critical time. Because having a baby is what we call like a sentinel event. It's such an important event that happens in your life, and you don't get this time back. And so for you to slow down, take a breath, and shift from doing into being.
Oh, that's
just
so
being in this moment, and it's a moment you'll never experience again.
And then if people don't have family around, because I know in New York City, a lot of folks move here, I'm going to suggest, and this was something I actually give friends that, well, my friends have all had babies, but like new parent friends, some hours at the postpartum doula. My friends did that for me because my family wasn't around that much because of where I lived. And that was able to help my partner and myself, my husband and myself. So I love that you included that. So thank you. Thank you.
Yeah.
Where can people find your work?
Yeah, so you can find me on all the socials. You can find me on Being Dr. Karen on Instagram, Being Dr. Karen 1 on TikTok.
Is there a Being Dr. Karen without the one? Did someone beat you to it?
No, somebody imitated me.
Oh, no.
And they took over the Being Dr. Karen. So I had to create a Being Dr. Karen 1 on TikTok. So if you want to follow me there, I talk about all things women's health. On LinkedIn, I'm Dr. Karen Sheffield-Abdullah. And I have my own website, Being Dr. Karen. So, hey, you can find me there.
Amazing. And well, you just mentioned your TED Talk, the one that I listened to that I loved.
Yes, and my TED Talk. So please, who gets to be well, really thinking about culturally relevant mindfulness ways of managing mental health concerns in the postpartum period, for sure. So really thinking about big level, high level, what could we do to really impact mental health for birthing people in this country.
Oh, thank you so much. I really enjoyed getting to know you and talk to you. And thank you for all you do for the birthing community and the postpartum community.
Yeah.
And thank you just for sharing your knowledge.
Yeah, it's been a pleasure. Thank you so much for having me, Deb. I really appreciate it. And I value your time and your listeners' time.
Thank you.
This has been an episode of Yoga, Birth, Babies, produced by Prenatal Yoga Center. You can catch us on Facebook, Twitter, Instagram, and Periscope. I'm Deb Flaschenberg. Thanks for listening.